On client history form, if anything left blank, ask about it. Headaches. Why blank? Everyone has headache. What does job include? What do exactly might feel pain? If sprains, recent trauma, surgery, infectious conditions, when, how, where, age of problem. Explain leisure activities and reason for coming. Cancer, when, where, how long, meds, last treatment. Ask about medicines, vitamins, aspirin, herbs, anything. Any conditions, have explained where, when, how long, intensity, onsets. Sleep difficulties, amount of caffeine, amount of water, age of mattress and pillow, family stressors, any recent weight loss or gain. Objective. Anything that you notice, how are they sitting, talking with body, any repeat tics, gestures, or touching, how they walk, facial expression, body language. Medline, Tiffany Fields, PhD. Psychological effects, reflected methods, nervous and endocrine systems, chemicals of the body, mechanical methods, various types of force, areas most affected by massage, nervous and neuroendocrine, primarily reflexive, influence of massage, dopamine, serotonin, epinephrine, adrenaline, enkephalins, endorphins, dynorphins, oxytocin, cortisol, growth hormone, combined neuroendocrine influenced, ABMP. Rhomboid minor. Rhomboid major, T2 to T5, vertebral border of scapula from root of spine to inferior angle, root of spine of scapula, retraction, downward rotation, minor above major between spine and scapula. Rhomboid minor, C7 to T1, root of spine of scapula. Infraspinatus, infraspinatus fossa, greater tubercle. Greater tubercle of humerus, lateral rotation, extension of humerus. Where was that? Oh, okay. Okay. Lateral rotation, extension of humerus. Eye. Oh, the eye of sits. muscles. It's over the scapula. Latissimus dorsi, thoracolumbar aponeurosis, lower 6th thoracic spinous process, sacrum and iliac crest, lower 3-4 ribs, inferior angle, scapula, bicipital groove of humerus, extension, medial rotation, adduction of humerus. Latissimus means widest, dorsi means back. Teres major, inferior angle of scapula, lower third of axillary border of scapula, medial lip of bicipital groove of humerus, extension, medial rotation, abduction over latidorsi, latissimus dorsi. Okay. Teres minor, upper 2/3 of axillary border of scapula, greater tubercle humerus, lateral rotation, extension of humerus T and sits. Subscapularis, subscapular fossa, lesser tubercle of humerus, medial rotation, S in sits, between ribs and scapula, supraspinatus fossa, greater tubercle of humerus, abduction of stabilization of humerus, S in sits, quadratus lumborum, posterior iliac crest, 12th rib transverse process, L1 and L4. Lateral flexion of trunk or raises hip. Hip hiker holding a baby. Trapezius, external occipital protuberance. Ligamentum nuchae. C7 to T12 spinous process. Lateral clavicle acromion. Spine of scapula, root of spine of scapula. Elevation upward, rotation of scapula. Retraction of scapula, depression, upward rotation of scapula. Rhomboids. Major T2 to T5. Didn't I read that already? Yeah, okay. Just on a different page. Okay. Iliopsoas, psoas major, iliacus. T12 through L5, inner surface of ilium. Lesser trochanter of femur, flexion of femur at hip joint, if thigh fixed, flexion of trunk. Gluteus maximus, posterior sacrum ilium. Gluteal tuberosity of femur, and iliotibial tract, extension of femur, lateral rotation of extended hip. Medius, iliac crest, ilium. Greater trochanter of femur, abduction, medial rotation of femur. Minimus, posterior ilium. Anterior surface of greater trochanter. Abduction, medial rotation, femur. Why did I write big pimpin'? Erector spinae. Iliocostalis. Thoracolumbar aponeurosis, posterior ribs, cervical transverse processes. By extension of spine, unilateral flexion of spine. thoracolumbar aponeurosis longissimus, lumbar and thoracic transverse processes, cervical and thoracic transverse processes, mastoid process, spinalis, ligamentum nuchae, cervical, thoracic, spinaeus process, cervical, thoracic, spinaeus processes, occipital bone. It also does by extension of spine, unilateral flexion of spine, bumps of spine. Okay. Sternocleidomastoid. Manumbrium of sternum, medial clavicle, mastoid process. Biflexion of neck, unilateral flexion of neck to same side, rotation of head to other side. Sides of neck, Röntgen grip. Platysma, fascia over pectoralis major and deltoids, mandible, muscle around mouth, depresses mandible, draws lower lip downward, tenses skin of neck, turkey neck. 6. Deep lateral rotators of the hip, piriformis, gemellus superior and inferior, obturator interior, internus, and externus, quadratus, femoris, interior sacrum, ischium, obturator foramen, greater trochanter femur, lateral rotation of hip. Back routine, integration stroke, effleurage, erector spinae, sacrum and iliac crest of fan, low back petrissage, so funny, trapezius circling, trapezius pole, lateral scapula petrissage, kneed, myofascial release, low back circles, whole back ring, trapezius stroke, rhomboid fan, scapula thumb press, opposite low back ring integration. Splenius cervicus. T3 to T6, C1 to C3, by extension of neck, splenius capitis, ligamentum nuchae, spinaeus process, CT, T1 to T3, mastoid and occipital. Unilateral flexion and rotation of head to same side. Serratus interior, outer surface, upper B ribs, vertebral border of scapula, protraction, upward rotation of scapula, and stabilizes scapula against chest walls. Subclavius, first rib, costocartilage junction, inferior shaft of clavicle, middle third, stabilizes clavicle by moving it medially. Scalenes anterior, C3 to C6, first two ribs, bi-raise first two ribs during forced inspiration, assists neck flexion, unicis, lateral flexion, head to the same side, medius, these are all scalenes, C2 to C7, posterior C4 to C6, all insert the first two ribs. Pectoralis major, clavicle head, medial half clavicle, sternum head, sternum cartilage, upper six ribs, lateral lip, bicipital groove, humerus, adduction, horizontal adduction, medial rotation of humerus, clavicular head and flexion of humerus, sternal head, extension of humerus from a flexed position. Pectoralis minor, anterior rib 3 through 5, near costal cartilage. Coracoid process of scapula, protraction, depression, downward rotation of scapula. Levator scapula, C1 to C4, vertebral border of scapula, elevation downward, rotation of scapula. The chakras can have various levels of activity. When they're open, they're considered operative in a normal fashion. Ideally, all chakras would contribute to our being. Our instincts would work together with our feelings and thinking. However, this is usually not the case. Some chakras are not open enough, being underactive, and to compensate, other chakras are overactive. The ideal state is where the chakras are balanced. There exist lots of techniques to balance the chakras, mostly make overactive chakras less active as they are compensating for other chakras. To restore the compensation, they'd be overactive again in no time. To stop them from compensating the chakras they are compensating for must be opened. Okay. Root chakra, red. Healing stone, jasper, tiger's eye, red garnet, smoky quartz, black obsidian. Energy, emotion. Healing tone, Shiva, Shakti. Sacrum, healing oil, lotus oil, patchouli, frankincense. Sacral chakra, orange. Faith, emotion, spleen, healing stone, carnelian, garnet, hematite, red jasper, calcite, tiger's eye. Healing tone, sun, healing oil, neroli, myrrh, jasmine, orange. Navel chakra. Healing stone, citrine, topaz, golden, calcite. Healing tone, sun, knowledge, emotion. Healing oil, lemon oil, peppermint, juniper. Heart chakra, green or pink. Heart, love, emotion. Healing stone, watermelon, tourmaline, rose quartz, jade, kunzite, aventurine. Healing tone, earth. Healing oil, rose, cedarwood, bergamot. Throat chakra, blue.